Stroke is a medical condition where there is a lack of blood flow to parts of the brain. This can result in weakness of the arms and legs. Caregivers can use this video to perform simple exercises to stroke patients in the home setting. These physical exercises can help stroke patients remain active, improving their joint mobility and overall physical function. In the process, helps to reduce the risk of the person from developing another stroke and dementia. Now, let's work on the lower limb. Let's start with an exercise for your knees. Step 1. Sit well supported on a chair. Step 2. Hook the stronger leg under the affected leg. Step 3. Straighten your weaker leg as much as possible. You may use your stronger leg to assist with the movement, but emphasize more active movement from your weaker leg. Step 4. Hold for about 5 seconds before lowering it down slowly. Do a total of 3 sets of 20 daily. Now for the hips. While seated down, lift your affected leg up. Ensure your thigh does not turn outwards and that you are not leaning backwards. Use your hand to assist when necessary. Do a total of 3 sets of 20 daily. Now, let's work on the standing up and sitting down. Step 1. Sit on a chair with your feet on the floor, ankles slightly behind the knees. Step 2. Stand up slowly by pushing through your heels and bending at your hips. Keep your head up throughout the movement. Keep your weight equal through both legs. Step 3. To sit down, lower yourself slowly by bending at your hips and knees. Caregiver may provide some support at the waist or arm to avoid landing hard on the chair when sitting down. Do a total of 3 sets of 10 daily. Now, an exercise for the ankle. Step 1. Sit straight on the chair. Step 2. Keeping your heels on the ground and point your toes towards the ceiling. Step 3. Point your toes down and lift your heels off the ground. Do a total of 3 sets of 20 daily. Now, let's work on weight shifting while standing. For all the standing exercises, stand on the side where the person is weaker. Before we start, position a chair behind the patient for safety. Place your leg behind the patient to support them in case they lose their balance. Step 1. Stand with feet parallel to each other, hip width apart. Step 2. Move your hips from side to side, shifting your weight from one foot to the other. Keep your knees and hips straight throughout the movement. Do a total of 3 sets of 20 daily. Now, let's work on the calf. Place a low stool or coffee table in front of the person. You will need a towel for this exercise. Hook the towel over the ball of your affected foot. Using your stronger hand, hold onto the ends of the towel. Use the towel to pull your foot towards your body. Feel the stretch at the calf muscles. Hold the position for a count of 20. Repeat for the other foot. Do a total of 3 sets of 3 daily. This is another way to stretch your calf muscles. The caregiver should support the weight of a weaker arm at the elbow. Alternatively, the person can just use the stronger arm and keep the weaker arm at the side. Step 1. Stand in front of the wall with your stronger leg in front, slightly bent, and weaker leg behind, keeping it straight. Step 2. Gently lean forward onto the stronger leg until you feel a stretch in the calf of the weaker leg. Hold the position for a count of 20. Do a total of 3 sets of 3 daily. Now, let's work on the hamstring stretch. While seated, rest the heel of the weaker leg on a low stool. Gently lean forwards from your hips until you feel a stretch at the back of your thigh. Hold the position for a count of 20. Remember to look forward. Do a total of 3 sets of 3 daily.